first I'd like to go through a couple things that are going on right now in the state capitol. Legislatively, there's some things that we're very involved in from the business community. One is a Senate bill by Tom Dempsey, Senate Bill 306, which seeks to leverage the dish payments that hospitals receive to bring down $90 million to add to that $50 million to help fund programs for the uninsured to try to get those people on the rolls of insurance. It engages the private sector to accomplish that and reaches out to the carriers to try to engage them in that process. The target is to get 35,000 people off the rolls of the uninsured and with some health care insurance. Secondly, and I'm going to touch on this, and then also I'll end up with education, but the two go together. There's an initiative called Caring for Missourians that the university system wants to undertake. We know right now that there's a shortage of healthcare professionals, whether it's doctors, nurses, techs, you name it. And in Missouri, we don't have enough programs at the university level to train the demand that we have in the private sector, in the healthcare sector. What this initiative seeks is a $39 million appropriation to shift that to the university system to establish university programs, facilities, and faculty to handle the demand of people wanting to go into those careers. Last year, they had to turn away 225 potential students that wanted careers in those fields. The estimated economic impact of just one graduating class of this initiative would be about $53 million or more to the state of Missouri. People have said today during the course of the day that enough about healthcare IT, and we are big fans of that. The electronic record idea to be able to put that into place, it's kind of beyond me how we haven't got there quicker. I can go out to the lobby of this hotel, take out my ATM card, put it in a machine, and within 15 seconds conduct a transaction that's safe, that's accurate. It knows who I am, knows that I have money in an account, and I can get $20 out of that ATM. And it seems like we ought to be able to, with the technology is there to implement in this arena, whether it's on healthcare records or prompter pay of bills and fees. So we're at the chamber, we've been watching that issue. When we have a healthcare discussion among our members, it's mutually assured destruction sometimes, because we've got the payors, we've got hospitals, we've got providers, we've got insurance providers, and trying to get that disparate bunch to be at the table, stay at the table, and try to come up with some solution or compromise solution, it's very hard to do. We've always held it that the state and the federal government should be very cautious about mandated coverage. When you talk to the employer community, and it's much more exacerbated in April of 2009 and for the last 6 to 8 months, when employers are not looking necessarily 5 years down the road with any type of strategic plan, or 10 years down the road, where do we want to end up? There's an awful lot of employers out there that are looking to try to make it to the end of this calendar year and be in business and employ people. It's not good out there right now. I think we're going to get out of this a little quicker than most people expect. But right now, if you add any hint of a cost increase to any employer's bottom line, or almost any employer's bottom line, you're going to be looked at very cautiously. And that's why the increase, the annual increases that we see in healthcare is a very tough pill for our members and any other employer to swallow. It is what it is. The costs are there. Any way we can contain those costs or offer a variety of offerings, whether it's slimmed down coverage or elective coverage, we need to do that in the marketplace. One thing I wanted to talk about also was long-term care insurance. These are the facts. 44% of the people in this room are going to require some sort of long-term care, either at home or in a home perhaps. These are the numbers that are bearing out. And when you look at the demographics of our society, with the aging of the baby boomers, that massive group of population is approaching that time of life where they will need that care. It's something that we rarely prepare for, that while we have homeowners insurance, which will cover our house in case of a fire, we have automobile insurance, which hopefully we rarely use. Long-term care insurance more likely than other forms of insurance will use it, and too few people have it. And the state's created some incentives that are tax incentives, and also if you purchase long-term care, let's say you buy $300,000 worth of long-term care, you can spend down to that level instead of down to $3,000 before getting on Medicaid. You can protect your assets by purchasing long-term care insurance. What we've seen in the insurance market is also a shift to offering long-term care in a group setting. We employ 25 people. We had a presentation on long-term care, and 90% of our employees in this small business wanted it. If we institute any type of a copay, everyone wanted it. We can run this through our cafeteria plan. We can run this through a regular benefit plan that we manage at the chamber or in the employer. And we see more and more the attraction of this being offered in a group setting. To get an idea of how pervasive this is becoming in the market, raise your hand if you've taken care of your parents, grandparents, another family member, or they're in a home. Anybody? This is indication enough that we need to take another look at the overall insurance structure and incorporate that into a benefit plan potentially. We are big believers in market-driven solutions. We represent the free market. One of the things that I've heard repeatedly, whether it's today or in the healthcare discussion, is the need to have consumers become more practitioners of their care, more practitioners of wellness programs. We've heard about some incentives today about wellness programs, diet programs, the obesity problem we face with our children. We think that's critical. Our employees, the people that purchase healthcare, have got to realize that going into the ER is no way to take care of a cold, or that when I do elect to go to my doctor, it's not simply that $10 copay. There's a lot more being exchanged than just that minimal amount. So we believe that educating the consumer is absolutely critical. Any way we can do that, we'd like to accomplish that.